Hello there, Dr. Gary Rademacher here from Downtown's Healthcare. Alongside me I have Karen Ray, a nurse practitioner, and today we wanted to go over the top 10 questions that we get regarding regenerative medicine. Before I jump into that, I wanted to explain a couple things. So many times we get asked, like, are you a chiropractic office? And first thing I want to let you know that we are actually a medical facility that offers chiropractic care. My specialty is in trauma care and chiropractic. However, I haven't been treating patients for about 10 years now. I'm kind of like an administrator in a hospital. I just oversee things, and I just hire the best of the best when it comes to providers. And alongside me with Karen here, we have the best provider, I feel, in the state right now providing these services. In fact, Karen actually trains medical doctors. She trains, physician's assistants. She trains DOs. Pretty much every month, 10 to 20 people are flying from all over the country to get trained by her in injection procedures and regenerative medicine. So, in any case, without further ado, I want to go over these questions, Karen. So, basically, one of the top questions we always get right now is, what type of stem cells does Downtown's Healthcare use?
So that's a really great question. We actually have multiple forms of treatment. It really starts with a thorough evaluation to figure out what is going on and can we help. One of the therapies that we use is bone marrow, and we also use stem cells from umbilical cord products as well.
So what would be the delineating factor between using those two? Like, what's the number one reason why you'd use bone marrow versus using like an umbilical product when you're evaluating a patient?
Sure. After a full evaluation, it really boils down to, between bone marrow and stem cell from an umbilical cord, is age. There are multiple studies that have been printed that actually show that the cells, number of cells and robustness of the cells diminish as we age.
In our own body, you mean?
Correct.
Right? Got it. So the second question I want to ask Karen here is, if donor tissue is used, like an umbilical product is used, are there live cells? We get a lot of those questions. Are there live cells in those products?
Yes, we do get that question a lot. So as far as live cells, the product that we use actually has 2 independent third-party studies from major universities demonstrating the type of cell, the cell count, and the viability, or how many cells are alive with the product after it's been processed. So yes.
Yeah, that's a great question there. So another question we get is, how long does the treatment take? So if someone decides, hey, I want to get treatment in your office, when it actually comes down to actually coming into the office and getting the treatment, how long does that take?
Sure. The injection itself is about 10 minutes.
Wow, it's pretty fast.
It is.
But now, other than just the regenerative part of this and doing an injection, are there other forms of treatment that are prescribed to a patient other than just doing an injection?
Great question. I see this all the time, and this is why we do such a thorough evaluation in this office. We look at, if it's a joint issue, why is it breaking down faster in the first place? If I don't address structural, muscles, alignment, how long will this treatment actually last? So yes, we look at if therapy is needed, if we look at whatever other therapies.
Nutritional factors,
nutritional, massage, chiropractic, rehab, equipment, we address all those issues.
Awesome, thank you.
You're welcome.
Next question is, how many treatments do I need? That's what we get back quite a bit as well. Like, is this a one injection thing? Is it 2, 3? In your experience, what do you see?
Majority of patients, it's one stem cell injection for majority.
And you actually have a proprietary method, don't you, to where there's multiple procedures you may do with the patient that not a lot of other offices are doing, correct?
That is correct.
Yeah. Next question, are there any potential side effects?
Yes. It is an injection, so anytime you're breaking open the skin, there's always risk for bleeding, infection, swelling, pain, things like that. However, majority of patients, they just report if there is anything, maybe some soreness at the injection site. But I do use ultrasound, so these are visually guided for precision with these injections.
Great. Okay, big one here, Karen, is, are stem cells FDA approved?
Great question. They are FDA regulated. Because it is not a drug, they are actually regulated by the FDA.
Got it. So another big question we get is, how fast will I see results?
Fantastic question as well. A lot of patients will start to see improvement in the first couple of days, and that's usually the anti-inflammatory effect. However, the actual stem cell results, it's easily 6 to 8 weeks for a majority of patients.
Great, thank you. This kind of stems off another question regarding side effects, but the next question is, are there any potential downsides to this type of treatment?
Not doing it. Not doing anything about it is a downside. If it's degeneration, arthritis, those things are going to continue. So it's a matter of figuring out what's going on, why, how is it occurring, what can we do to help, looking at it from a comprehensive standpoint.
Yeah, and along with that, I think is it's really safe. When you look at the safety of this type of product being delivered, isn't it much safer than medications and surgery, what you've seen in your past?
Yes, absolutely. In fact, we study a lot of different companies, and of all the companies, there have been 0 reported complications or side effects with the companies that we use.
Awesome.
So very safe track records.
Awesome. Great. Here's another one that we get. Does insurance cover any stem cell procedures?
They do not at this point.
That's the unfortunate thing here, ladies and gentlemen, is that we're hoping that this is going to cover it in the near future. However, since it's still considered investigational or experimental, they're not covering it at this time. And the last question is that we typically get is, how much will this cost? And so I'll address that one. So, when it comes to cost, we do have a proprietary method of doing this, and so Karen and our medical staff will do various different types of treatments, and depending on what the condition is, the type of product that we use, are we using your own cells where we're harvesting it? Are we using an umbilical product? That cost can range, but it can range anywhere from $3,000-$4,000 upwards of $8,000 if you're harvesting your own tissue. I can tell you in 100% of the cases, though, that if someone has a financial consideration, we've never turned anyone away who really wants care. So if you really want care and you're really willing to work with us, we'll work with you. We do have many different financial options for people. So, that's all we have for today. Thank you for tuning in. And if you have any other questions, please call 303-292-9992. You can also go to our website, Downtowns Healthcare, that's with an S, downtownshealthcare.com, to get more information. Thanks for tuning in, and we look forward to seeing you here real soon. Thank you.